joined today by the sponsors of the legislation in the House and the Senate, Representative David Bentz, who's the prime sponsor of H.Bill 160 in the Senate, Senator McBride. Thank you both for joining us today. We also have Wayne Smith, who's here, is the president and CEO of the Delaware Healthcare Association, representing hospitals across our state, great partners over the last 15 months as we've addressed COVID-19 and responded, and our hospitals, of course, on the front line. And then Meredith Tweedy, who's representing Christiana Care, again, a great partner over the last 15 months. We also have Pam, who's our sign language expert for the deaf and hard of hearing. Thank you all for joining us. Thank you for the work of the General Assembly, particularly the two sponsors that are here with us for this really important piece of legislation putting in place going forward. Mechanisms necessary, some really kind of detail, but to better deliver telehealth services to Delawareans. One of the things we've learned a lot over the last 15 months, particularly in partnership with our healthcare providers and the hospitals. And one of the things that we tried to do a lot more of before, but really came to the fore over the last 15 months is the whole concept of telehealth and delivering services kind of in a Zoom call like this, over the phone, et cetera. And it was obviously a very safe way to do this with COVID-19. It's an efficient way. There are lots of details that had to be worked out. We did some of it under emergency orders and some have been put in legislation, and this is a major effort to do that. And so again, thanks to Representative Bentz, Senator McBride, and your colleagues in both the House and the Senate, Wayne and his team at the Healthcare Association, of course, our hospitals, Christiana Care all the way down to BB and Nanticoke in Sussex County. So with that, I'll turn it over to Representative Bentz. Representative Bentz often takes the lead on complicated healthcare issues. We particularly appreciate his work on this piece of legislation. Thanks, Representative Bentz, for being with us.
Thanks, Governor. I appreciate all your support on this effort. My friends from the industry, from Christiana and our health systems, and Senator McBride and all my colleagues in the House and Senate for so much support around this. And what this bill does, just to sort of provide the high level discussion of what this does, is it takes a lot of, honestly, Governor, a lot of the stuff that you put into place around telehealth at the beginning of the pandemic, a lot of the loosening of restrictions that were in place around telehealth, and it makes a lot of those permanent, over the last year and change since the start of the pandemic and the need to really break down barriers to telehealth so people could still see their doctor in a socially distant world. We learned a lot. We learned a lot about what works, what doesn't, and what can continue to be helpful in, hopefully a post-COVID world that can outlive this pandemic. And what we learned was a lot of it increases convenience, not only for patients, but for doctors as well. So what we're trying to do here is take what was a real learning experience around telehealth and implement best practices on a more permanent basis. The other thing that this does is it enters Delaware into an interstate licensing compact around healthcare providers. And what this will really do, to put it into context for people watching, is obviously being a small state, we have a lot of physicians inside Delaware who have patients outside Delaware, who reside outside of Delaware. And we have a lot of Delawareans who have physicians who practice outside the state. And what this will do is facilitate their ability to have telehealth delivery across those state lines, and it breaks down a lot of jurisdictional barriers that exist. So not only expanding access within our borders, but expanding access outside our borders as well. And really just, hopefully making the best of a terrible situation and trying to learn something through this COVID pandemic that can improve healthcare delivery on a permanent basis. And so, Governor, I appreciate all your support and your leadership, really sort of getting the ball rolling on this with your response early on in the early days of the pandemic. So thank you.
Yeah, it's a really good way, Representative Bentz, of characterizing it, making the best of a very bad situation. And again, telehealth was something that had been thought of for years. We just, practitioners just weren't making it part of their normal practice. Folks weren't as comfortable with it. Got to be a lot more comfortable. if the alternative was going in person and visiting an office where there might be exposure to COVID-19. And so the provisions that were put in place, many of which are around the licensure question, really are being put into the statute with this piece of legislation. We appreciate very much your leadership, Senator McBride, leadership over in the Senate.
Thank you so much, Governor. It's an honor to be on here for this telehealth bill signing. I want to begin by thanking you, Governor, for your leadership over the last year and a half of crisis, and of course, the incredible representatives from the healthcare community who worked on this bill and who helped see us through this crisis as well. And of course, I want to thank the prime sponsor of this legislation, Representative Bentz, for his thoughtful and inclusive leadership. As a freshman, it's been a real treat to watch Representative Bentz really methodically meet and consult with stakeholders across healthcare to craft this legislation and the soon-to-be newest law of our state. To the point that you and Representative Bentz both made, crisis really breeds innovation. And throughout the last year, we've discovered deeper ways for us to harness new technologies to connect with one another, to increase efficiency, to expand access. And thanks to you, Governor, for your decisive leadership early on, and Representative Bentz and Senator Townsend, my colleague in the Senate, you all were able to temporarily codify the expansion of telehealth. And we and Delawareans more broadly were able to see in record numbers the efficacy and potential that telehealth brings to bear in breaking down barriers to healthcare. And I think the expansion of telehealth can sound really technical, but the law that you're signing today will mean that more Delawareans will be able to get the care that they need. Families in rural communities will be able to access telehealth even if they struggle with reliable internet. A single working mom will be able to better communicate with her provider after hours. People with disabilities will face diminished barriers to care. Delawareans who find themselves facing a health emergency when they're out of state will be able to get care from their hometown physician. A newly diagnosed cancer patient will be able to more quickly consult a specialist, a potentially life-saving interaction precisely when time is of the essence. And because of the experience and insights that, as you mentioned, patients, providers, and policymakers have gained over the last year, this legislation expands telehealth with important safeguards to protect quality. And ultimately, when we're able to remove barriers to care, we're able to improve access, enhance outcomes, and in the end, save lives. And so I want to thank Representative Bentz for letting me join him in this effort, for the advocates and providers who helped pass this legislation, and you, Governor Carney, for your support of this critical bill.
So you listed a number of benefits that we've gotten from telehealth, one of which that I hear a lot about is on the mental health side. Obviously, counseling and that kind of thing, something really critically important during the last 15 months was made possible in some cases, and certainly easier over a Zoom connection where you can actually see the person and have that. It's not the personal touch you get in person, but it's pretty darn close. And so really good opportunity there. Wayne Smith knows this issue from both sides, both as a former member of the General Assembly and majority leader in the House, as well as his role leading the Delaware Healthcare Association, a great partner with us in the last 15 months. Wayne, share with us the perspective from your partners there in the Healthcare Association. I think you're on mute.
So I'm sorry, am I unmuted now?
Yep, you're good.
Okay. I wanted to thank you for the comments and echo the comments you made regarding the partnership we've enjoyed over the last number of months during the pandemic, and the great number of issues that we work together with your administration, your office, and also members of the General Assembly in helping to make sure that Delaware's healthcare system remains at its excellent status and improves over time. This is certainly a significant bill, and I want to thank you and also Representative Bentz and Senator McBride for their work on this important legislation. It's a pleasure to be here today representing all of our hospitals as you'll be signing House Bill 160 into law. We certainly appreciate the support of everybody on this call and Representative Bentz and Senator McBride's colleagues in the General Assembly. to make telehealth benefits that were underscored during the pandemic, as you noted, Governor, a permanent part of our healthcare landscape. With House Bill 160, all Delawareans will enjoy more access to care. And this is literally a lifeline for those in rural areas, those with disabilities, those with transportation challenges who face barriers often in accessing in-person medical care. The ability to utilize telehealth in all of its manifestations brings needed medical care into the home for many, and this will mean medical care for some who would otherwise go without. You mentioned, and several of you have mentioned, the interstate licensure compact. It's of great significance, and particularly for a small state, if you think about the number of specialists here versus outside of our borders, but particularly for Delaware, the ability to draw on medical expertise more easily across state lines with House Bill 160 is tremendously significant in terms of access to care. I'd be remiss also for not noting the special significance of the work of my friend and colleague, Meredith Stewart-Tweedy, who's on the call with Christiana. She was very heavily involved in conceptually turning the executive order into some ideas for legislation, and also the technical aspects in working with legislators such as Representative Benson and Senator McBride and their staff. So she really deserves a nod for leading our team in terms of helping to put the thoughts of our hospital members together to produce this legislation. So again, thank you, Governor, very much for making this important change in Delaware's law. We appreciate working with you.
Thank you very much, Wayne, and thank you for your leadership and help during the last 15 months with your member organizations. Really, one of the hallmarks for me has been the ability to talk to your top people on a weekly basis, as you know, with respect to testing, treatment, vaccination, you name it, and all the things that went into that. We could not have made the progress that we did without that constant communication, and I know that you made that happen on a weekly, bi-weekly basis. Meredith, thanks for joining us and bringing in to this discussion the perspective of the largest healthcare organization in our state, Christiana Care. Again, a great partner during the last 15 months.
Thank you. Thank you, Governor, for your leadership and early championship in the response to the pandemic of telehealth and expanding telehealth access and scope of practice. And thank you, Senator McBride and Representative Bentz for sponsoring and supporting this legislation. And I really appreciate your willingness individually and collectively to really get into the weeds on technical regulatory issues. It's in working through a complicated piece of legislation that's really important. And this has been a game changer for Christiana Care, for our patients. We had a 3-year telehealth plan that we expedited and got a lot of the pieces in place in about 3 weeks. It has been tremendously beneficial to the patients and the communities that we serve. As you noted, Governor, behavioral health access is always a challenge, but we have data showing that patients are much more likely to show up for visits with their behavioral health providers if they do not have to come in, and they can do those visits, when it is safe and appropriate by telehealth. So we're very encouraged by that. And of course, telehealth allows access to primary care in rural areas and underserved communities, also in urban areas. And we're really excited about the promise of the health hub that we have put in place with virtual care access points in Wilmington at the Kingswood Community Center, and we're working on the Latin American Community Center. So very excited about the potential to continue to build access and expand equitable access to care for our community. Also, just I want to personally note, as a citizen and a parent of 2 young active boys who sprain ankles and things, and also have an elderly parent at home with a lot of medical appointments, really appreciate the benefits of telehealth. And I think everyone can say that it has been one of the silver linings of the pandemic. There are not many, but definitely one. So thank you very much.
Thank you, Meredith. This certainly is getting into the weeds, not letting the weeds get in the way of good public policy and good healthcare delivery of services. It's my privilege as governor now to complete the work, the good work of all the stakeholders, all the folks who deliver healthcare services in our state, particularly our large hospital organizations, Representative Bentz, Senator McBride, their colleagues in the House and the Senate. I checked the vote, was unanimous in the Senate, unanimous in the House, unanimous in the Senate. There was one member absent, but it speaks well of the good work of everybody on the screen and the importance of this issue to all Delawareans in terms of providing better access to healthcare services. And so with my signature becomes law. Thank you all for your great work.